Good morning, everyone. Thanks so much for joining us. This is Kirsten Logan. I'm the training coordinator for COVA, and I am thrilled to be welcomed today by Alex Turnicliffe, the Community Engagement Manager for Aunt Bertha, and he's going to explain what that means and show us the Findhelp platform. Before we begin, you will receive an email a little later on this afternoon that is your proof of attendance for this training. Please save that for your records. And if you are applying for COVA's voluntary victim advocacy certification, go ahead and submit that with your application. If you're watching this later online, we do hope that you enjoy it and find the information helpful. However, please note that archived webinars may not be used for COVA victim advocacy certification. If you are not familiar with the GoToWebinar platform, I'm just going to guide you very quickly and turn it over to Alex. The toolbar is fairly minimalist. So this is a listen-only presentation. In the top right of your screen, you should see a toolbar with an orange box and a right-facing white arrow. You click that out, you should see handouts. Alex has provided us with 3 handouts today. So if you click the smaller arrow on that handouts pane, you should see those and be able to download those during the presentation today. If you do have any problem with that, you can contact me later and I'm happy to send them to you or Alex. And then you should also see another section that says questions/chat. That is how you can enter any questions or comments for Alex, and he'll pause a few times during our time together today, and I'll moderate those for him. And so with that, I'm going to say hi and bye, and know that for COVA members, if there's any other training topics you would like to see, please let me know. And Alex has also provided us with a summary version, about a 10-minute version of this presentation that I will endeavor to drop in the chat. I will put this on our YouTube channel a little later if you miss some and want to watch the whole thing. All right, thanks so much. And Alex, I'm going to turn it over to you.
Wonderful. Thanks so much, Kirsten and COVA, for having me today to present to you all. Again, my name is Alex Turnicliffe, and I'm the Community Engagement Manager with Aunt Bertha here in Colorado, based in Denver. And I support community-based organizations across our great state of Colorado in learning about our Findhelp.org platform, how they can engage with it to connect themselves or family members, clients to resources, community-based resources, as well as being program providers, how to list and engage with the platform in terms of the services they provide so people can find them and have a way to connect through the network. So today we're going to be going over a little bit of information on who Aunt Bertha is, as well as our Findhelp.org platform. Highlight the nationwide coverage. We are a nationwide digital community resource platform. Also share some information about what that is looking like here in Colorado. The bulk of today's presentation will be a live demo of the Findhelp.org site. So if you are familiar with Findhelp.org, hopefully you learn a few tips and tricks to increase your engagement and the value of the platform. If you've never heard of Aunt Bertha or Findhelp, then I hope this can be a useful tool for you in the work that you do. And then I do want to make sure we leave some time to recap, go over sort of key takeaways from today's presentation, as well as call out potential next steps to be able to put the access to the network to use. I shared those 3 handouts that you'll all have access to, and I will be available following up post-event if you'd like to grab some time with me to chat one-on-one about how your organization or community can learn more. So with all that, I will turn off my screen so you can focus on my presentation, and we will get started. So again, focusing on Aunt Bertha, we are a company based out of Austin, Texas, started about 10 years ago. And our focus is really to connect all people in need and the programs that serve them with dignity and ease. It's really that last part that we focus on in terms of ease of access, making a communal platform open network available for anyone to find and search for free or reduced cost direct service programs, whether it be a food pantry, GED classes, health services, etc. and then also trying to make it easy for folks to identify a way to get connected with the program, and even building in sort of feedback loops through our intake tools of getting that dignity of a response when you reach out. So definitely we'll highlight that. But Aunt Bertha was started in Austin, as mentioned. Our founder, Aaron Gray, really started it from personal experience, having experience with his mother who contracted a rare brain disease when he was in his 20s. And a few years later, he became her legal guardian and moved her out from upstate New York to Austin. And he was really struggling to sort of find and connect her to longer term care and wraparound services. And he just had that personal experience of saying it's very difficult to navigate sort of the social safety care system. Professionally, Aaron was working with the state of Texas during the height of the recession in 2009, 2010 to connect people to their state level programs, WIC, SNAP benefits around food, and trying to streamline that process technologically to make it easier for people to apply and then follow up on the status of their application. So these two sort of developments came to a head, and when he was ready for a change, he decided, I wish there was a platform out there that we could really, have easy to access, anyone open to find information and get them connected to the help as easily as possible. So the German of Aunt Bertha was started. People often ask about the name Aunt Bertha. The original tagline was Aunt Bertha picks up where Uncle Sam leaves off. So the idea of beyond just government programs, is there a way to index and connect to broad-based community resources? So whether that's nonprofits, faith-based, corporate social responsibility, our platform lists programs that really meet a pretty wide criteria of being free or reduced cost and having that direct service component. So what is Findhelp.org? It's an online directory of free and reduced cost services across the country. It is completely free for anyone to navigate anonymously to look for resources for themselves or others. And it's free for nonprofits to list and manage their program and service offerings on the platform. And both Findhelp.org as well as other sites across the country are powered by Aunt Bertha. So Findhelp.org, we use it to demo. It is our sort of public benefit facing site. Aunt Bertha is not a 501c3 nonprofit. We are a certified B Corp. And so we are mission-based, and we have a model of actually selling customized versions of our platform to larger organizations. So whether that be in the healthcare space, government, or in education, we have partners across the spectrum and across the country where we are able to customize kind of a platform that's a window into the Aunt Bertha house. So on the back end, all of our program information, which is humanly curated by a data team in Austin, Texas, of now up to 65 people, it is shared on the back end, but the different versions or windows into that house, our customers can sort of figure out what best fits the need of their community. And so while we'll be demoing on Findhelp.org, you might come across another site in your community that looks somewhat similar, and then you'll be able to apply the same stuff you learned today. It's just powered by Aunt Bertha, but there's a different curtain over the window, if you will. And to show you some examples of that, I'm here in Denver, in Metro Denver, Jefferson County. We actually partner with Jefferson County Public Health on an early childhood initiative where they have an instance of the platform set up to really direct people to social, emotional, parenting resources and supporting families. So they're able to tailor things in terms of the navigation, the programs that are featured, etc., and able to meet that need. Additionally, here in Denver, we also work with Work Now. Work Now has a really specific niche. They are trying to connect people in the communities affected by the I-70 interstate expansion that cuts through Denver to construction jobs and opportunities. And they use this platform to both feature their partners in that initiative, as well as provide access to wraparound services. So again, it looks pretty similar, but if you go to findhelp.org, that's a perfectly fine way to access our network. All right. Next, I want to go and share a bit about what it actually looks like in terms of the stakeholders that use Aunt Bertha. So the title of this webinar was Advancing Community Resource Navigation, really trying to dig in and say who would be using this platform to connect the various stakeholders. We always start with the seeker. Our mission is really seeker-based. We talk about seekers as those individuals searching for services. We're all seekers at some point in our life, and we really want to raise awareness and make people aware that they can access this information for themselves, to just go and see what is out there and try to make a plan to get the help that they need. It's great if they're working with someone like a care manager, a social worker, case manager, but we don't want that to be a barrier from them to be able to access and get this information and a plan of action themselves. So definitely encourage among your organization and your clients self-navigation of the platform as a tool for them to use. A lot of people also use the platform as a helper. So those are individuals who are either more informal, a family friend, or someone who is in a professional capacity like a nurse, a teacher, a community resource coordinator. They are able to leverage Findhelp.org to be able to share program information with clients, customers, friends, family, as well as coordinate care through some of the referral technology to send referrals, to connect the seeker, as well as follow up. And we'll get into just a little bit on that today, but we'd be happy to talk to you one-on-one to sort of go deeper on how your organization might be able to leverage the full free suite of tools that we offer. And together, this is partnered with, of course, the wonderful community-based organizations or CBOs that provide these free or reduced cost programs across Colorado and across the country. And many of you are on the line, so we really appreciate everything that you do and appreciate the opportunity to connect people to all the great programs and services that you offer. Together, that makes up what we call the Social Care Network or the Network of Aunt Bertha. Here's a snapshot of just how we have grown over the last decade. We are now across the country in every zip code in the country. There are over 6 million users that have used our network across the country, and we now have indexed almost 500,000 program locations. The benefit of being a nationwide platform is that when you run a search for your local zip code, you will not only be bringing in those community resources that are local, the food pantry down the block or the behavioral health clinic, you will be also bringing in state level programs available to anyone in Colorado if eligible, as well as nationwide programs, which during COVID, there have been a lot of initiatives and services that are actually offered at the national level. So if your data directory resource sort of catalog is hyper local, it's always useful to run a search through Findhelp, especially if it's a program you don't have a go-to solution for, because it will bring in that wider tail of services at the state and national level. And because of that, that means each and every county shows up at least 1,200 plus programs in the network. I wanted to provide this local context since I think we're all located in Colorado. This is a snapshot of the searches in the network in the last 6 months. And it is 150,000 searches from October last year to April of this year. And I think it's really interesting to see we have more search activity along the Front Range. So a lot of this is taking into account those more major metropolitan areas, you know, Fort Collins, Denver, Colorado Springs. But you see housing obviously is the story there, that at least almost a third of people are searching for housing. A lot of that may be related to rental assistance. Then food and health as well. We've seen food grow quite a bit. Of course, I think we're all familiar with the food insecurity that has increased during COVID. And so it's really interesting to see. This is aggregate across the state, but we can go in our metrics to sort of have a built-in community needs assessment where we could go down to a specific county in rural Colorado or a zip code and say, what does need look like in that community? And then where are the resources mapped and where do those gaps lie? And that's really powerful data we can share with our partners to be able to help better serve people and get their needs met. So in a rural area, you might see transit become a greater search. And so it really depends on where people are looking. They tell us a story of what is going on in their lives and what they're looking to get connected to. couple more slides and we'll hop right into the platform. But why use Findhelp.org? Hopefully you see the utility today as I demo, but really want to call home that this is an open network. It's completely accessible by anyone, anytime, anywhere in the US. We are a HIPAA compliant and high trust certified platform. So the information shared through basic referrals are private and secure. So you can be confident that the information, we take the secret privacy very serious, and we provision access only based on those that have claimed the organization's listings and have turned on to receive basic referral information or set up a screening form to capture more information. And then really the flexibility of the tool, both in terms of the user or seeker and helper. They can use it on their phone with the Aunt Bertha app. They can share information via email, via text when they find a program or programs that are a good fit. They can print it off. They can translate the site into different languages. And then on the CBO or program provider side, we also want to be flexible and let the experience meet their needs where they're at. So organizations that claim their listings, they're able to set up their program services in the platform to be directed wherever they want. So whether they opt into one of our free tools like referrals or appointment scheduling, or they're just pushing people to a phone number, a centralized intake email like info@, or a existing website contact us app or application form. We really want them to be able to identify that best way that someone should reach out. And then the idea that this is not just within one sector. We don't work just in healthcare. Across the continuum of life experience, we want a no wrong door approach of people being able to access this through their schools, through their clinics, through their libraries, wherever they find themselves, they can access and get connected to the network. So that's enough long-winded conversation about Aunt Bertha. I will pause and sort of see if any chat questions come in from that overview about Aunt Bertha before we jump into the actual demoing of how to use Findhelp.org to advance your community resource navigation efforts.
I'll give folks a moment to type. Alex, you kind of asked who was on the line before. It looks like we do have a good chunk of folks. Probably 50% of our folks online right now are from our more rural areas.
Great. That's helpful, Kirsten, thank you. And yeah, that is definitely good to call out, because whereas there are fewer programs and services in general in more rural areas, we definitely want to continue to build out and grow our network. I will say both in usage and in resource mapping, we are strongest in those urban corridors, but we are expanding and actively looking to partner to build out sort of the resources that exist. In rural communities, sometimes, there might only be 20 or 25 key resources. And so it's actually easier to leverage this platform to strengthen collaborations and working together than, of course, in Denver, where everyone seems to have a nonprofit service, which is great, but it's harder to kind of have consensus and work together.
Okay, no questions at the moment. Thank you.
All right, great. Well, I'll take that opportunity to jump right into the Findhelp.org site. And I am going to log out of my account. There is the ability to create a free account with Aunt Bertha, where you can access additional features and functionalities, which I'll point out when is the case. But we want to make sure we can get people 90% of the way searching anonymously, removing that barrier so they can just use it to see what's out there without being tracked. So here we are at Findhelp. Pretty clear call to action of typing in your zip code. A lot of times people don't necessarily think in terms of zip code. They think more in terms of their county or city. In general, unless a program is so specific, they only serve maybe 2 or 3 zip codes, like perhaps a church pantry, food pantry. You can use your zip code for your general city and you'll capture most of the information. But we do have sort of the zip code as a geographic point of entry. Before I type in a zip code here, demonstrating just in Denver, you can play along at home if you are able to navigate the dual monitor or minimizing windows. But I will point out that, again, I mentioned languages. You can translate the Findhelp.org or any Aunt Bertha platform into over 100 different languages. And this is really great to meet the needs of individuals who, again, are self-navigating. If English is not their first language, they feel more comfortable reading in another language. And throughout, we have ways that you can translate information over email, text. And so it's really helpful to be able to serve people, again, where they're at. So I would go right in and type in a zip code here in the Denver metro area. Click search, and I'm off to the races, and we'll see that there are over 2,300 programs listed for this zip code here in Metro Denver. Again, that is capturing both local programs, those statewide programs, and even national programs. And there are ways to kind of isolate just local programs so you know what is just in your neck of the woods. When you come to this page, you have the opportunity to kind of identify needs that you're looking for. So one way to do that is to go up here to the search bar. You can also translate the language up here. It moves to the top. And you can put in a keyword. So we had talked about housing. I could put in housing, see all the different program tags, as well as the top sort of program matching. It's not always the greatest indication because the general program names are often, pretty redundant or pretty high level. So going and using these tags is a good way to go in to say, I want to look for maybe help paying for food, during the pandemic. If you know of an organization in your community that you want to look up, you could also type in directly that organization's name. So here in Colorado, we have Colorado Coalition for the Homeless. I could go and see all the programs that the network has indexed for them if I know of a specific provider. So it's either general need, or you can search that provider there. Or if you want to jump serving someone on the phone who was first in Denver and now you're talking to someone in Fort Collins, you could type in another zip code and restart the search there. A lot of people use, though, this navigation bar to really go in and drill down and see what resources are available. So it's these 10 sort of basic domains of need: food, housing, goods, health, gets into a lot of stuff with these subcategories and tertiary categories. Care is kind of a catch-all for, you see, foster care, animal welfare, end-of-life care, education, work, and legal. So for demonstration purposes, I'll search for something that, again, you saw in that needs assessment is pretty common, which is food. So looking here in Metro Denver for food pantries, and we'll search that and see that 28 programs appear in my search results. So they show up as these program cards. Now, we index everything at the program level because that's more indicative of meeting a specific need. Instead of starting with the organization, we want the ability to break out their arms of programs and services to match with those needs. But for instance, if I know that Metro Caring, which is a large sort of food pantry organization here in the metro area, they have other services like ID assistance. I can click on their name of the organization and see all those additional programs. But because I searched for food pantry, it's mapping to their food pantry tag and showing only those food pantry programs here. So I could go down and peruse sort of the programs that show up. I can also say, well, I really am looking for that food pantry that's close to my zip code, to my area. I could toggle over from relevance over to closest. That's not going to read where anyone is, even if you're logged in. We're not tracking where you are. It's the midpoint of that 80219 zip code, and from there tracking how far from that midpoint these services are. And so they'll grow from shortest to longest. As you scroll down, you'll see that grow. Okay. In terms of going over kind of the program information, you'll see that we have that program name, the food pantry here at the Denver Indian Center. I could click again on that link to see other services provided by the CBO. Have an overview of the food pantry, the services. This is how we map to the searches, as well as who they serve. Now with food pantries, thankfully, it's often open to anyone in need, especially during the pandemic. They've been waiving a lot of residency requirements. And so this is, most of them will be similar, but there are other programs where these who they're serving tags are really helpful because you can drill down by filtering these results to really match to that program that meets you or your client's need. And I'll demonstrate that in a minute. So here we have information on the Denver Indian Center's food pantry. I could fly this out to see more information. We always start with eligibility in case there's a hard stop eligibility requirement for that program, as well as the availability. So at the top of search results, unless you go to that closest search, it should be showing you programs that in general meet more anyone in need and are programs that are available. If the Denver Indian Center went in and changed their food pantry listing to closed or wait list because they've claimed their program, they have access to edit this information directly and choose how people reach out through the platform, they would be deprioritized. So if it's closed or on wait list, it'll go further down in the search results. Here's a fuller description of information on the program, the languages offered, which is good to have because it reflects in the filtering you can do. The cost, whether it's free or reduced cost, we always link to the program's website and or social media to dig in deeper. And then if there are additional program locations beyond this one, we'll list up to the 3 closest locations here at the bottom. You also have that map view if you just want to go and see spatially where programs are, and then you can click into their listing. And so once you have this information, say I put on my kind of helper hat, and I'm Hector the helper, and I am connecting with a client named Susan. And I say, Susan's looking for food, she doesn't know about any food resources. And I find this Denver Indian Center's pantry. Say it looks like she meets the criteria. I can look at the hours, and I can say, all right, I can either print this off as a hard copy leave behind as we move more to being across desks from each other, or, which was really great during COVID, I can go in and share this information about this program with Susan. I can share it either via email, I could share it as a text, or I could even share it on Facebook, which is part of that just meeting people where they're at. Although I would advise against, personally tagging Susan on her Facebook wall and saying, hey, here's a program to address your food insecurity. But we do offer that option. For email or text, you can also go in, leave a message, sort of put it in context, choose the language of that email or text. So if you're navigating in English, but a client is more comfortable speaking in Belarusian, you can share that information, again, in a way that meets their needs. So that's a great way to just share specific information. You also have the ability, if you connect with that program or you have information that maybe some of this info is out of date, you can suggest an edit to this program. Anyone on the platform can suggest and say, hey, they're actually only open on Fridays now. Send that to our data team down in Austin, and within 48 hours, they will update that if it needs to be updated, even if the program is claimed by the organization, meaning they have access to update this information on their end as well. Our data team is great. They work diligently to try to capture and update information across the country. Their goal is to actually 95% of programs are updated every 6 months. So even if they're claimed, we have our data team doing their due diligence to try to get this information right biannually. But of course, we know during COVID, 6 years might as well be 6 days, so 6 months might as well be 6 years. So sometimes we really rely on and appreciate that crowdsourcing ability to let people let us know where we need to right size and update. It definitely takes a village, as I'm sure if you've worked with any resource platform or any resource directory or Excel list you've kept for your organization, it is a task. So basic information on how to run a search for a need, find the results, dig deeper, and share that program information. So you can share information one at a time, just this individual program listing, or what's really cool, we launched about 6 months ago, is you can actually share multiple programs. So say I say, here in the 80219 zip code, I just want to find those food pantries that are closest to where Susan is at. I can go in here and start clicking these check boxes. You'll see at the bottom, this yellow box starts to populate and grow. This is sort of your program cart. So think of it like an Amazon shopping cart, although instead of getting a doodad for the kitchen, we're actually just trying to connect people with information to help solve their needs. And then once you have those programs you want, you can open this up, and in your program cart, you can either save these as a favorites folder for easier access of curated lists of go-to programs, which is a feature you have to have a login for to be able to save that. But again, it's free to create an account. Or I could email these programs as sort of a mini curated list. So it's not just a single program. Instead of giving someone a big thick book of community resources and say there's good stuff out there, go have at it and get connected, you can specifically identify based on their assessment of needs these program options and give sort of a mini curated list of resources. You could also print this to be a leave behind, 3 to a page, so you can have, again, physically that little mini resource guide. And then once you save it, print it, or email, you could clear your cart and you could go again. So you could continue adding to your cart in different searches, so it wouldn't have to be all in the same vertical of need. So definitely want to point that out. Now, I
Hey,
had
Alex,
mentioned.
I'm sorry. Can I pop in with a question while we're still in this
Yes,
section?
please. This is a good stopping point.
Awesome. Thinking about our, our domestic violence and domestic violence and stalking victims and survivors who a lot of us on this call work with.
Yes.
I love the fact that it's not being tracked because we know all that is sort of, death by 1,000 cuts when you're trying to protect your online data security. But so the question would be, like showing there the Indian Center, if I'm the survivor who's self-navigating and then I go in and I click on their Facebook page or their website, at that point, am I then subject to whatever tracking might be on those platforms?
No, unless it's being called to enter specific PHI or PII like information about yourself. No, we don't track anything in terms of what people are clicking on, except at an aggregate level. The only thing that's sharing personal information, which I'll get into, and we've actually built in safeguards for vulnerable populations, as you mentioned, is if people are using these next steps that are part of the intake tools, which are electronic referrals or scheduling, and I'll get into that later. But no, in terms of poking around the site, if you're logged in, it's tracked so you can go back and see what you've been looking at and sort of get metrics and reporting of how you've engaged in the platform that can be useful. But if you're not logged in, at no point are you tracked or identified.
Thank you.
Yep. And so that's a great question. And that's definitely something that we built into after we were working with domestic violence sort of shelters, safe houses, where they said, hey, when folks are reaching out, and I'll get into this later, but if I wanted to make a direct referral to a program that has that option activated, you will share information, and we even have built in a way to say, do not reach out to this person because that could put them in an unsafe situation. So no, great question, Kirsten. So food pantries, again, I had mentioned, really open to almost anyone in need. So all these could be maybe good choices and eligible. Say you're looking for another resource like maybe mental health care, and you're looking for counseling services or maybe substance use counseling. You would have maybe a higher program count here, 43. This is what shows up. Again, can toggle to what's closest in my zip code. And if I really want to say, hey, there's a lot of great options out there, but I want to look for ones that help Susan, and maybe she's, a teen or something, I could use these personal filters to be able to cut through these 43 programs to find those that maybe are best set to meet the needs of my client and their current life situation. So these are dynamic filters of who they're serving, who they're serving category here. This is what the filters sort of are used to dig deeper. So these will only show up like this in this search. So at least one of these 43 program listings has, at least one of them has these indications. If I ran another search, this would look different. So it's just showing those ones you could actively filter by. So say I'm looking for maybe teen services, or I'm looking for, based on program information, I want to visit or get connected to those programs within maybe 5 miles from my zip code, or those that I can actually apply for right on through the platform, whether that's a referral or directing you to their website application. If you're searching in the middle of the day, or you work during the week and you need services on weekend, you can filter based on hours. All services, again, free or reduced cost, but if you really are looking for that free resource, you could toggle and it would suppress those that have maybe a sliding scale or require payment. And then in terms of the program offerings in different languages, that maps to the more information here. So if they list additional programs, different languages they're able to support, that's how you could filter and say, I really want programs that offer services in a different language, say Spanish. I would, recommend not trying to overdo it with the filters. Start really with basically those ones that meet this need, and then of course, if you have to have something that's close or free, you can use these. But if you overdo it with the filters, sometimes you just won't end up with anything. Which I wish there was a program that met all needs all the time. So that's the program filters. We do have the ability to cut through the listings based on income eligibility if that program has been set up with a specific income eligibility criteria here. So on the back end, programs can list an eligibility around the federal poverty level, so maybe 200% of FPL. And then you go up here and you type in your household size, how much money you make per month. It will calculate that against the federal poverty level and bring up those that you fall under and can qualify for. But that's only for those programs that have actively been called out here in eligibility around income. So definitely great if you don't find a good program, or you find a search result with lots of programs, you can cut through using those filters to really find those more relevant resources. Okay. I want to then next transition to, well, what do you do once you get this information? I mean, you can print it, you can share it, but what if someone is ready to reach out, or you reach out on their behalf? Each program, the idea of the platform is not just to be a yellow pages index of resources where everyone goes to their website, or everyone goes to a 1-800 number, the general intake line, a general admin line. We want to identify for those services, what is that next best step? So over here on next steps, you'd have, go to the website if you want, see the information around hours and address. And then this teal bar will tell you what either our data team has identified as the best next step for that program to reach out, or if it's a program that has claimed its listing, that they have sort of set up and had control over how they reach out, whether it's those referral tools, or right now they're just pushing you to their program website or a phone number or email. And so a big part of my role is to really activate communities and work with organizations to let them know that they are listed on the platform, that people are finding them, and give them a path to being able to have an access to this information, update it, and point to where they would like to go. So our data team controls how they show up when they get into the network. Then we really want to partner and engage with them to have them get their local buy-in on meeting them where they're at in their workflow. Okay. So we have different next steps. Some of them might say contact here. If I was logged in, I could actually see it say referral and send a referral. So I'm logged in here as Hector. That login does open additional features as mentioned. So I can save that folder, specific program, to either a favorites folder of resource lists that I've created already, or I could create it as a new folder, and I could access those so I don't have to start an organic search each time and say, well, here are my go-to behavioral health resources in the area, and I can share those over and over again, however I'd like, or print out. So that is the benefit of actually taking what you might have as a 3-ring binder at some of the organizations I work for, an Excel spreadsheet if you're fancy, or even maybe just Post-it notes around your computer, and trying to streamline it and have that curated access to share with other stakeholders, either in your staff or clients. Another thing I can do is, we talk about share, saving these. I can even, when logged in, leave notes on programs. So if I've connected with Aurora Mental Health Center's teen outpatient program, I can maybe say, well, this was a really good program. I want to keep this as like a highly rated program for my population or my clients. This is not Yelp. That will not go back to them. It will not be public on the site. It's just for your reference. And then I could add additional information, like talk to Mary for support group options, or Jennifer on staff speaks Spanish, or make sure client brings their ID, whatever you'd want to sort of capture that you could have for reference later on. They list information about the program, but we know many of you that work in resource coordination have developed sort of insider knowledge over the years, and this is a great way to be able to actually save that. And the cool thing is, right now, I can just save this note for myself, but if I actually worked for one of these organizations and I could be added on the claimed account, then those individuals can actually share both save favorites folders and notes on programs with each other as sort of a care coordination effort where we could actually share these resources and notes together, so it's not all on one person. So if you work for an organization that provides free or reduced cost direct service programs, we could get you set up so that you'd have that sharing ability through the platform. All right, and so that is basic information in terms of searching, sharing, saving, and filtering program information. Now you get to the next steps. Sometimes just pushing to a phone number, that's fine if that's the way that the program refers to be connected to. If they want a more a robust way to track and manage outcomes and close the loop on those people of interest in reaching out, they can use one of our intake tools. And those are referrals, basic referrals, referrals with a sort of screening eligibility form to capture more information, as well as a calendar appointment. So I won't get into the details of how to sort of have your program set up on the back end. That can be a follow-up training, and reach out to me if interested. I hold those monthly. But just to give you the options, I'll show you sort of what the different intake tools look like. So I can go to my favorites folder here. And as Hector Helper, I can say, well, I put together, all these lists, and for demo purposes, I'll use our Bertha engagement CBO. Aunt Bertha doesn't provide direct services, but we have this fictitious entity to demonstrate sort of what it looks like on both ends. So we have the ability to send those basic referrals through the platform. That looks like this, Bertha employment training. If they have refer, or if you're not logged in contact, you can actually send an electronic referral to that organization. So me as Hector Helper, maybe I say, all right, they meet the eligibility, I can refer myself, or I could refer, in this case, a client. And I could actually, if I referred before for someone, it would auto-populate. So I work with a client named Susan, and I think that this is a good fit for her to maybe get some job and skill training. So I can put in Susan's information, it auto-populates. I need to put in her name, and then I can put in email and or phone number, as well as their language, preferred language. And then I can decide what is the best way for them to reach out. And that's either email, text, phone call, or this is what I was referring to. The don't reach out means that that organization has no way to contact this individual, but they know that this person's expressing interest, and then either yourself or the seeker would be then have the onus of following up. But that is there so that you can make sure you don't share any program information or any PII, personal identifying information, beyond the name. All right. I could say, email is the best way to reach out to Susan. I could add a comment to this referral to say, Susan is currently looking for work in retail sector. You can say I'm her case manager. Here's my phone number. Any background information that would help give context to this referral. We are that HIPAA compliant, high trust certified platform, so we capture consent, verbal consent on every referral, that you're able to share this information and that the privacy guidelines will be protected. And then I could send that. So if I went into here, had all this information and said, I'm going to send this referral off, 3 things would happen with the referrals. One is Bertha engagement would receive an email saying Susan was referred to their program. Susan herself would receive an email sharing that she was referred if you captured that text or email information. And then you, as the person in the middle, the helper, you will be able to track and contribute to the status of this referral through your People I'm Helping dashboard. So this is a tool we built in that said, well, great, I have this information. I send someone and got them connected to a program, but what actually happened? What was the outcome? What was that response? And so even if a program does not offer any of these intake tools, for example, if I go here, and this is just that different platform, and I find maybe a emergency food program, Even if the next steps says to go to the website, whatever, I can still log a referral and capture in my dashboard, my metrics, that I have connected a client to this program. Now, the CBO itself won't be in the loop to be able to close the status of that referral on their end because they don't take those, but you giving the information or following up or having the client tell you what happened can track and manage the outcome. So you can have a holistic view of how you successfully connected people to programs and services to meet their needs. So I wanted to call that out. But here I made that referral. Let's go in and say, all right, I want to see a week later maybe what happened in connecting Susan to this program. If I don't already know, I can go up to my name. I could go over to people I'm helping, click on people, and this will show everyone that I've sent referrals through. This Hector Helper is a new hat, fictitious hat I've made. So I've only helped Susan and Michael Jordan. And so I could click on Susan and get her sort of profile view, and I could see all those referrals that I've made for her and the status. I would go to navigation history. Here right now is the Bertha employment training referral I made today. I can see that the status is still on not updated. So maybe if the organization has not gone in and updated that status, or Susan, who also has access, if she creates that account, can go in. I, in the middle, can also contribute to that shared knowledge and say, I connect to Susan, I know she's enrolled in that program, she got help. And that will be cascaded to all the other parties so everyone's on the same page. I could even go in and make a note like, Susan, is going to start your program on, 5/1. And I can make this note visible to people outside of your organization and people who are seeing that referral, which means the Bertha engagement folks. So I can sort of share more information as we sort of chat back and forth, and it will all be cataloged here, what happened. So that's a way, again, to dig deeper than just saying, hey, I'm going to text you information on this program. I actually want to, in a more hands-on approach, connect you, refer you, and follow up to those programs. So if you work for community-based organizations that are either on Aunt Bertha, and if not, I'll show you how to get them listed. If you want to explore partnering with them to have this more easily accessible referral outcomes tracking route, you can connect them with me, or we can get them set up so you can actually make those referrals if that's something they choose to engage in. Completely, again, up to the organization what they want to do in terms of enabling those next steps. I can make sort of overarching goals for Susan and house referrals under them and sort of track the status of those goals. All these statuses, both for goals and for the individual referrals themselves, those are static. So you cannot customize them, but usually organizations will sort of assign their own meaning to maybe certain language and maybe only choose like 2 or 3 that they map to their current workflow. We are not a full-blown case management system, but we do offer these light case management tools to make it useful for folks who engage in the network. All right, so that's the basic referral. The other options, I won't go into great detail due to the sake of time, but you have the ability as a program provider to set your programs up to be able to capture more information. So say for my Aunt Bertha programs, I want to, basic referral, name, email. I need more than that. I actually want to get like a pre-screening application form to see if they're a good fit for my program. This Bertha Housing Authority, as an example, if it says apply here, it means you're walking through a referral and screening process. So it says this program is currently waitlisted. I want to add Susan to the waitlist, see if she can qualify. So I go back in again. I find Susan's information. I say, okay, yes, basic information. Instead of saying submit, I'll say next if there's a screener form attached, and you can go in and click next. That will bring you to basically a Google Doc that they can build on the back end that asks more information, make certain questions required, and on the back end, under the logic, they can have certain questions that have eligibility significance. And that means you're actually being pre-qualified for programs, and they can receive your application as either may be eligible or may not be eligible. They always can follow up, but it sort of helps them figure out where someone's coming into their program or service at. So for Susan, I could say she needs help with housing and demographic information if they want to capture that. And then I can even upload any documentation required by that program to facilitate and make more efficient connecting this information. I can go in and review and submit, and then it will tell me in the submission screen, thank you, we'll review your services, see if you're eligible, and reach out to review when your review is complete. If you map those eligibility questions, you can actually have the auto response be, looks like you may be eligible for this program, here are next steps. Or if it's a hard stop, you only serve veterans, and they say they're not a veteran, instead of just saying, sorry, can't help you, you can set it up to say, it looks like you may not be eligible for this program, but here are additional services that might meet your needs. And you can map either to resources on Aunt Bertha or external links that can maybe support people with that need that do not have that hard stop requirement. So that idea of giving people a warm handoff and trying to help them as they continue their journey. All right, I know I'm running a little bit behind, so I just want to do the very last tool, and then I'll pause for some questions. So if you have those ready, you can chat them out. We have the ability to also, we work with Connect for Health Colorado across the state to facilitate their health insurance enrollment assisters to connect with community members. So if you go to Connect for Health, this is how I like to demonstrate our scheduler tool because it's actually in practice. If you go to the C4HCO website and go to Assisters, you'll see that they have this little search box powered by Aunt Bertha, and search for an assister in your area. Again, using that Denver-based zip code, I can say, well, I want to look for an assister who speaks Spanish within 25 miles of me, and it will show these results. This is exactly what it'll look like if you have scheduling enabled or your program partners have scheduling enabled. You can go in and sort of see Servicios de la Raza, which often, primarily serves the Latinx community here in Colorado, in Denver. I can say, all right, let me see what they have. They're only within 3 miles of me. I can open this up and see the availability of appointments that they have sort of managed availability of when they can see people. And so I can actually, from a customer community member standpoint, see, yeah, I have some availability tomorrow at 10:30. I want to book that appointment. And so you see basic information similar to that referral, name, email, or phone, best way to reach out, capturing that consent, and then that will book that appointment, and then Servicios can reach out automatically or in follow-up with the Zoom link, or if it's in person, you just show up at that time. So that scheduling tool is something that we actually built for the Assister Network with C4HCO, but we've made that available for any program for free that is listed in our network to use as a next step. So if you see schedule here, they've enabled that scheduling tool for people to self-book. All right, it's a lot of information. I know as Kirsten mentioned, this webinar will be recorded. Those handouts will share some more information. So as you think about using the platform, I'd like you to think about two sides of a coin. One is actually using it to search for services for yourself or others. But also think about your own free reduced cost programs or your community partner programs and how they might be able to leverage our site and network if they aren't already. You can always go down and at the footer of any Aunt Bertha page, you can suggest a program to be added. And that's a good way to see if the program's already in the database, because I could say, food pantry of Bank of Larimer County in Colorado. If it's a general name, put the state, because we have those 500,000 program locations across the country. And I could see, okay, food bank is on here. Maybe I work for food bank and they don't have another service. I could say, all right, in addition to these, I want to suggest this program. So anyone can suggest a program as long as it meets our need. We'll add it within 2 to 3 business days. If you already are listed or work for an organization, you can press claim your programs. You could again search for that example, and you could see whether I list them. So it actually goes here and it brings in some of the search beyond that program. But I could say, yeah, I want to claim this listing. It'll give you that option. As long as you work for the organization and your email is sort of at, foodbanklarimercounty.org or whatever, it will automatically verify that you can unlock these programs and claim them. If you're using a Gmail or Yahoo, there's a 2-step manual verification process. You want to make sure that you actually have the authority to claim your programs on the site. All right, so I've been talking at you for a long time. I'm doing a little more of that. I want to pause for questions, and then I'll sort of highlight these key takeaways to distill what we've learned today.
Yeah, super interesting. I love that scheduling tool.
Yeah, if your first touch point is like an intake appointment, it's been really helpful, especially in COVID during those virtual appointments where they can just sort of say, hey, don't come to the office, but we can talk over Zoom or whatever.
Okay, no questions popping up at the moment.
All right. Well, hopefully I am just ticking the boxes on this, or I've completely overwhelmed you and you're in shock. But again, I'll be sharing out that sort of 10-minute high-level walkthrough of the platform that you can go through at your leisure. Kirsten, if you haven't shared that out, now might be a good time. And then you can share that with any colleagues. And really, as I'll share in the last slides, I would love to be able to connect with your organization and you all one-on-one to really talk through how do we get your organization more engaged in the platform as another tool in your resource navigation toolkit? How can we leverage this as a useful site for your community? So high-level recap, use findhelp.org to search for programs, starting with that zip code. Browse those social service programs, either entering keywords that track to the program tags or the program or organization name itself, or use that navigation bar to really drill down based on areas of need. And the great thing about the platform is if you're on the phone with a client and they're moving to California, or you want to help your cousin out in Bangor, Maine, you can just type in that zip code search and find programs for them as well. So really having that apples to apples nationwide touch point, I think it can be really useful. For those programs that have the referrals enabled, and if you have community partners that you think might benefit from this, I can get them set up. You can refer to those programs, capturing that information, and track and manage sort of outcomes based on the people I'm helping dashboard, like case management tools that can help sort of make sure that the people you're working with actually got connected. So even if it's not refer, you can still log that referral and capture that you've connected them to those programs, either by printing or sharing out, and then close the loop for yourself on those outcomes. And that will be captured, and you actually have analytics and reporting that can show you over time sort of what someone has done, how you've helped people. That managing people you're helping. And we can do a deeper training, with your organization if interested. All this is completely free to use, and it's part of our social mission to meet people's needs where they're at. I really find that the creating favorites folders is so helpful, because I know organizations I've worked for, everyone has it in their head, maybe a good program contact, but a lot of times, you might just do a Google search from the beginning if you have, a need that's not obviously in your wheelhouse. This allows you to create those customized resource lists that you can share with others or refer to as appropriate. So it's just taking those paper-based stuff that we used to all work with and maybe moving it more to an easily accessible and shareable place. And if clients don't have smartphones or access to the internet, you can always print those and leave them behind as a takeaway. In terms of next steps, what come out of here, I would say poke around on findhelp.org in your area. Create a free account to set up those favorites folders, and then definitely connect with me. I'd love to be able to sort of map out what are additional community resources we could be adding, either for your organizations or those that you work with. We're in this for the long haul, so mapping the country's free and reduced cost services is no small feat, but we are chipping away, and we really would love to enhance engagement and participation in the site in your area. Encourage you to suggest a program. If you search and find that something that is beneficial to community is not on there, suggest that. Our data team will review that, humanly curated. These are not robots, these are people doing this work. At least 2 people will touch that program and get that program set up. And then they will, if you work for the organization, they will give you the option to claim that. If not, I will engage with people to say, hey, you're on the program, here's how you can take ownership of that and use some of our tools. If you already work for an organization and see that you have it listed, you can claim that organization. Once you claim it, you can provision access to other staff members, so it's not all on one person to update any information, or if you use referrals to track and manage that referrals, you can do it as a team, and that can be a deeper training that I can provide to you all. Definitely spread the word. I mean, other places and resources. You know, a lot of people ask about 2-on-1. We're complementary, I feel like, in some ways in 2-on-1. That sort of website, self-navigation, I think we offer things they don't. They obviously have a call center, which we don't offer for people that want to put their needs out there. We actually partner with 2-on-1 across the country. So definitely reach out and would love to connect. I know I'm at my time, so I will just stop and I will be able to hang out for a couple of minutes if people have questions in the chat. But definitely reach out and connect if interested in exploring further. Thank you so much to Kirsten and the COVA team for having me on, and I hope that this was useful information for you today.
Awesome. Thanks. Yeah, looks like folks are typing away. I did post the link to that 10-minute summary video in the chat. It was quite a long link, so if any problem with it, go ahead and let Alex or me know, and we can get that to you. And just a couple folks saying this is an amazing platform. Thank you so much.
Cool, thanks. Yeah, I hope if it wasn't on your radar, it can be just another place that you can look. I mean, we're all in this together in terms of connecting folks to resources. I know many of you are direct service providers on the front lines. I know it's been a tough year for all of us, but especially people engaged in this work. So I just want to doff my cap and say thank you so much for all that you do on a continual basis. And we'd love to support that work with our platform if that's helpful.
Excellent. Yeah, just some folks saying thank you and enthusiastic about it. So yeah, again, and that you've got 3 handouts. You've got my information in the chat, the link to the shorter video. And yeah, with that, I'm going to mute, but we will hang out for just a couple minutes to see if there are other questions. And if not, I hope everybody has a wonderful lunch.
Yes, let's eat.
Okay, just a couple more folks saying thank you.
And the good